Folks. It's Friday. I have to check the date. I'm glad my computer screen has a date on it. It's Friday. It's July the 17th. And here we are. Frankly, folks, it's been a really tough week. Uh, over the last week, or 10 days or so, actually, the Care South Carolina family has been diminished considerably. First, we lost Joan Alston. Joan had retired from us. But if you knew Joan, you knew a bubble bursting with joy and energy and happiness. And if you knew Joan, you could not um, deny her request to purchase a ticket to the Care Innovations Black and White Gala. She was a real powerhouse, and the energy that she brought to us and to the community and to those she loved and all those who surrounded her is a really big loss. And then we've also lost another member of our Care South family, Patrick Bynes. Patrick was a young man, wasn't but 36. He actually was employed by us, but in another grant. He actually worked with the Northeastern Rural Health Network, which was really covering the counties in Dillon, Marlboro, and Chesterfield. Care South Carolina has been a founding member of the Northeast Rural Health Network, and we hired Patrick a number of years ago. Patrick was a dedicated community person. He organized so much. His heart was so big and caring, caring for folks. He brought services to so many people through the Northeastern Rural Health Network. And then more recently, South Carolina has lost one of its incredible leaders, Charles Love. Um, Give me a minute. Charles was uh, the son of Dr. Love. Dr. Love was an orthodontist, I believe that's correct, a dentist up in the Marlboro County area, McCall. People came from all around to go to Dr. Love, and at one time he was on the board of directors of Care South Carolina. He was a wonderful gentleman, caring and compassionate, really driven by his dedication and service to his community. When he passed away, he left a foundation and great legacy. Charles Love Jr., his son, was I reckon you would say, president of that foundation. And it was through that foundation that so much benefit has been reaped on McCall and Marlboro and on Care, South Carolina. It was with Charles's leadership at the Love Foundation that our building in McCall came about. It was Charles' dream to see a state of the art building with medical services, a wide variety of other health and human services like social services and behavioral health, and then, of course, rehabilitative and wellness services, all of which he got to see. As a matter of fact, when Charles passed away, he was at our McCall facility um, using the rehabilitation and the wellness services. He got to see his dream fulfilled. Um, I've never known many folks who had the heart and the love for a community as did Charles. So we've lost three very important people in our family. I ask us all just to take a moment. I need a moment. Let's just take a moment and thank the generosity, the spirit which each of these folks brought to us and to the communities. Join me in just a moment. Thank you for that. For many of y'all that know, by the way, our building in McCall has a tower to it. Um, I have asked that the tower and the building go dark for the following week to really communicate that a light has indeed gone out with the death of Charles Love. Okay, I'm going to move on. Other sad news though. We have had 3 employees over the past week that have tested positive for the coronavirus. That's more than we've had ever in a week's time. That's real concerning and very heartbreaking. A lot of the tracing that happens when a person tests positive, the tracing that figures out who all they've exposed or been with or so forth, has revealed that none of the possibility that their exposure really was not a workplace exposure, but could have been related to um, community and to things that went on in the community in sharing uh, over the holiday weekend with other employees or with their family and friends. So once again, I really issue my my plea to everyone. This is a vicious virus. Even though folks that test positive may or may not ever become sick, we still don't know what it's doing to our bodies. For those that only become mildly sick, we don't know. We don't know what can turn up. For those that have become seriously sick, that sickness has often gone way beyond a period of hospitalization, even. So please heed the word of our specialist and our epidemiologist and our scientist who give us so much information. Please be careful. This is not the flu. This is a very serious pandemic. All right, I'm going to shift gears. Today, our team is over in Lamar, and we're doing a testing event over there, and that's probably a text message that's given me the update on how many we've tested. As a matter of fact, it is. The last time I left it, they were already at 350. Um, they are really doing quite a bit of community testing. And very exciting, our Moby, our first Moby. Remember the Moby, the mobile van we're going to have one for each county. Our first Moby was delivered yesterday. We took it over to Lamar. Amanda and her team in public relations and marketing have done a video that you'll soon be able to see and share. We're really excited about the Moby. We can foresee a partnership with the Department of Health, identifying hot spots that are still popping up across our region, churches, schools, law enforcement agencies, where we can deploy these MOBIs, which will have a staff of about 3 people on it. There'll be a lab technician and a nurse, and then either a community health worker or a medical assistant or someone that'll help do registration and get data and information. But we're really excited about the possibility for these, and we'll be getting the rest of them. They'll roll off the production line about one every 3 or 4 weeks, as we also get the remainder of the four. So the Moby is here. We have one, and it was really exciting to actually see it and see the Care South Carolina logo on it, and to go inside and to look forward to what purposes we'll be able to use it for, which in the future we'll be able to use it for chronic disease testing, going out, catching up with people who haven't been in the office for a while, maybe doing immunizations, vaccinations, and so forth. We've got a lot of good potential use for these, even after we manage to pull out of this pandemic. Speaking of the pandemic, there's been a lot of good developments that have been happening over the last week or so. A lot of what you may be hearing, a lot of our local communities are beginning to take very seriously the spread that is happening and what they can do. MACB, for example, has actually passed a mask ordinance requiring masking. Hartsville has made a strong recommendation. A lot of these communities, Hartsville, for example, also have been giving away masks. You've also probably been hearing on the news the big box stores, the Walmarts, the Lowe's, the Targets, or have now started putting into place mandates that all the customers, when they come into the store, must be masked. So things are really beginning to take place, taking this pandemic very seriously. South Carolina remains on the hotspot list, and this is a very scary situation. It's a very concerning situation. I know that everyone has heard the plan that schools in South Carolina will be opening on September 8, and the governor has mandated that the schools will have 5 days of face to face option along with a virtual option. I know that this is having a tremendous amount of stress and anxiety on many of you out there. And my heart is really breaking because what a terrible determination to have to make, putting kids possibly in situations. And many of you have family and friends that are also teachers. This is a very scary situation, and I want you to know that our feelings and our hearts and our souls are with you, as many of you have to grapple with this and scramble to make some very tough decisions. We're with you. When I mentioned that South Carolina was still a targeted state, there's only one county in the entire state that is not considered a red target area, and it's in our service area. So, Marlboro County, kudos to you. You've done a really good job. Keep it up, because I think we've got a lot to learn from Marlboro County. Marlboro County has been taking it very seriously. The PDRTA there has been requiring masks, so they have been very diligent in what they do. And speaking of RTA, the Dillon and Little Rock RTA bus is going to be opening up in a couple of weeks. So we'll have even more services that can become available. So there really is a lot going on. Um, there's a lot going on as we address this pandemic. Many of you are also aware that the management team had a lot going on this week. And you might have been wondering, the management team took 2 days out of our very busy schedules to have workshops. Uh, you know, I can't stress how much stress and anxiety we all have been under. And it's been almost nonstop since March. We've had to do things that we never dreamed we would have to do and do them quickly, pivoting to telehealth, scrambling to create safe environments when supplies were hardly even available for personal protective equipment. This has been one of the most challenging times in my entire 40 years experience at CareSouth, and even longer. I've been in healthcare for even longer. I cannot remember a time that we have all been stretched to our breaking points, to like rubber bands. Frankly, I had decided that the management team was at a point now where we needed to take some deep breaths. We needed to get our heads in a place that could let us shepherd the organization in the continual progress that we have to make against this pandemic, and forward to keep Care South Carolina strong, keep Care South Carolina healthy, and keep our own hearts and minds nimble and energized, because the battle is not over. We've got long months ahead of us. So, um, we did. We took time out to do this. We took time out with a group that we have worked with almost now for 10 years, that knows us in and out, that knows who we are, that knows our strengths, knows our weaknesses. And we took time out to regroup and to really reaffirm ourselves as a team, and to reaffirm who we are and who we wanted to be at Care South, what we wanted our culture to be, what we wanted to gird ourselves with as we continue on the battle for the pandemic, against the pandemic, and the battle to keep our patients and our communities and you, our staff, safe. We have reaffirmed a lot of our strategies. We have reaffirmed a lot of our work that we have engaged in. We've gotten, I think I can truly say this, a new vigor, a new renewed strength, a renewed charge amongst ourselves. And we've opened up some new possibilities. We have become more committed than ever to employee growth, to identifying those amongst you as staff who really embody the very heart and soul of Care South, and to figure out how we can support your growth, how we can support mentoring, how we can support additional training, what we can do. So that is one of the things that we see that's going to really empower us to go forward with the strength that we're all going to need um, to get through this. We re-energized what we want to see in a culture of responsibility, what we want to see in a culture where everyone not only is safe physically, but also feels safe, feels emotionally safe to be who they are, to share their experiences, to share their ideas, to share their worries and their concerns. Many of you have done that after my weekly message. You have felt very safe to email me and to tell me what your worries and concerns are. We want that safety to spread like the virus that the coronavirus is, but this will be a good virus. This will be a virus of strength and a virus of energy, a virus of commitment, compassion, and ongoing care for each other. So we did take 2 days. Well, actually, it was a day and a half, because we did get the news around the loss of Charles Love early in the afternoon on the Wednesday, and frankly, that shattered so many of us that we had to take a break. But we did take that time, and we've got some other time scheduled because we want ourselves to be the leadership that you respect, the leadership that you care about, and the leadership that cares about you. So that, as I just said, not only can we have a culture of physical safety, but a culture of emotional, mental safety, that it's okay. And we're going to do that. We came back energized. We came back with some new ideas and some new thoughts. So, folks, I'm going to leave you today. I've talked enough. I looked down at the clock and it says, my goodness, it says it's 20 minutes. That's enough. That's enough time for y'all to have to listen to me. I love talking to y'all. I love hearing from you. Keep it up. Um, Together is going to be the key. Together, not singly, not just me, not just your supervisor, not even just your co-workers, but together we are going to be South Carolina strong. We are going to tackle this virus of coronavirus, and also the other viruses that I've talked about, the viruses of racial injustice, the viruses of stress and worry and concern and heartache. We're going to do that. I know we will. Y'all, please stay safe over the weekend. Come back on Monday and let's continue our journey. South Carolina strong. Bye bye, everybody.